How do we know? Because these are papers published in refereed journals and highly respected journals. But I must caution, if I generate more hope than necessary, it would be improper. These are all results published in respected, highly respected journals, but you know, there is a huge gap between the cup and the lip, as we say, proverbially. Therefore, taking it to the level where man, human beings, patients benefit from this, there may be some difficulties. But this wonderful review article by I. Rasovich from Oxford University this year gives me confidence to come and put up the second part of my talk. Shall we proceed? Before I proceed with my second part of the talk, I want to pause for a minute. Is there somebody who would like to comment on the first part of my talk? Water-soluble fullerene derivatives for material science applications. Because what I am going to speak now is going to be very different. And I know this is not an audience consisting of medical specialists or biologists. But the first part of your talk, the talk that I gave you, very much the bread and butter of Sekri. Any comments? Any thoughts? In some ways, like we paint something with water and water evaporates away. So it could be useful, people say. And it may bring down the costs as well.
No, but I hope if you make it water soluble, it will be more expensive than what is C60, right?
Not necessarily, because
since you start with C60,
yeah,
and then you will functionalize, so you will add some additional cost.
Yes, yes. Very good question. In fact, 1 gram of fullerene I bought cost me 50,000 rupees. So it's not cheap. You are very right. But as we know with computers, PCs, mobile phones, when the sales become very high, cost drops dramatically. There is a company in Arizona, in United States, which is selling 10 grams of fullerene. If you buy 10 grams, you can get it for 25,000 rupees. If you buy 100 grams, the cost dramatically drops.
Also the purity. If you buy 99.9,
fantastic,
it's a different state, and then 99.8, it will be different.
The one that I am using is 90. Please.
MT, there is a company called MT, and it's a US-based company. I do not know exactly, but it's cheap. These days it's very cheap.
What you have said is exactly and on the target. 99.9% purity of fullerene I have used. But if you use anything slightly lower purity, cost dramatically drops. But when you derivatize, make it soluble, you make it more homogeneous, because the insoluble portion is removed. So it becomes very useful candidate for especially medical applications and pharmaceutical applications. When we are doing any solar cell and so on, maybe we can do away with that degree of purity that would demand for human use as a drug.
But I have one more question.
Yeah.
So this functionalization and then solubility, water solubility is also applicable for C70 also?
I think you're very right. Already the same methods, but the properties and characterization of C70 is slightly different. And C70 is also available, but slightly more costly for the same company. But I think whatever I'm saying is not only applicable to C60, it is equally applicable to C70 if we can get it. It is equally, we have already done it, but I'm not going to show it. It is equally applicable to single-walled carbon nanotubes. It is equally applicable to the much cheaper multi-walled carbon nanotubes, NWCNTs. And it is equally applicable to graphene. Remember, Koyakoti and his group in Cochin, in Edapalli, in Amrita Institute, Amrita Hospital, with Professor C.N.R. Rao as a co-author, have actually used graphene to produce drugs where they are able to do photodynamic therapy, and they have taken patents, and I presume they may have even gone on to the stage of trying it out on critically ill patients. So, answer to your question is, C70 can be handled in the same manner. I have handled with my own hand, SWCT. One more problem was with these nanocarbon materials, somebody published a paper without doing any experiments that they are toxic. Same thing happened with crown eaters. Somebody said crown eaters can pick up potassium, sodium or something, so they will harm the human body. It delayed progress in that area of science by about 20 years. Similarly, in the medical applications of nanocarbon materials, some people, at least one scientist later said, no, I did not do any experiment, I just said they will be toxic. But it has delayed because there are apprehensions in the minds of people. Will these nanocarbon materials be washed off from the human body? Will they accumulate in some organs? There are some very interesting studies on plants, Arabidopsis thaliana. You see that the hypocotyledons, which are the things below the earth, below the soil, they are longer. That means the plant will be stronger, and you can put the seed lower down in the soil. But they have studied distribution of these nanocarbon materials in the different parts of the same plant. It has been shown to be present in the leaf, it has been shown to be present in the roots. Every part of the plant, the nanocarbon material is reached. Would you want to be very sure that over generations of plants and plants being consumed, these nanocarbon materials will not enter the food cycle? We knew the story of DDT long ago. DDT was used, all over the place. Circles are considered one of the greatest successes of science. It turned out to be a disaster eventually when you found accumulation in the soil. So I should not oversell my thoughts. Thank you for your questions. Yes.
Actually, I have a small comment. Actually, we have done very fundamental studies on carbon nanotubes as well as fullerene nanotubes for biological applications. What we observed is our human system can digest your C60 nanotubes, not carbon nanotubes. So comparatively among the carbon nanostructures, C60 materials are safe. So that's what our very preliminary studies. So after that we didn't continue that. So I cannot comment more on that.
I hope not only do you continue, I hope you collaborate with me at this age.
This was I have done long before.
So I
10
understand.
years before.
No, but it's a very interesting comment you have made. Your good name, sir.
Satish.
Satish. Satish. Very good comment, because the fact is that undoubtedly single-walled carbon nanotube has not got an approval in the United States yet. But FDA has given approval, I understand, for C60. So it is considered relatively safe. One of the reasons is it's homogeneous. So it can be followed more closely, precisely what's happening to it. So your comment is very well taken. Please believe me, the comment you are making based on some studies a couple of years ago, that water-soluble nanocarbon materials are useful for treating cancer, for treating tumors, for treating arthritis, for treating HIV AIDS, for treating influenza, for treating Alzheimer's, for treating Parkinson's disease. What is it? Is it a panacea for all? Is it a water that's an amrit? Is it an elixir? Please see and enjoy the results. But ordinary people with whom I have spoken in the last 1 year are excited. Taxi drivers, auto drivers, common people in the public. Hey, my mother died of this disease. If you have something, please give it to me. This is the level of expectation among the general public. One of my students, she was Shanti Swarup Bhatnagar Award winner, died 1 year ago of breast cancer. She was gold medalist. She was the board topper, mother of a 17-year-old. Believe me, Charushika Chakravarti was my student, and she died March 2016 of breast cancer. One form or the other are treated with drugs like doxorubicin, etc., suffer from heart damage. That means these drugs are cardiotoxic. The person is already suffering on two counts. The person is having cancer. Second, the person is losing financially. It's such a financial burden on the family, other than the psychological and social problems that the family has. They are bankrupt. I remember as head of an education institution, I was asked to sign a bill for a patient, 1 month, each month, one injection, rupees 50,000 rupees. 6 lakhs. 2 years the bill is 12 lakhs. And the entire budget for the college was 14 lakhs. How can you sign 12 lakhs for one person? That is what we are talking about. So if there is a use in society, then it's no longer a question of money, no longer a question of name, fame, prestige. But if there is an element of truth, there is an urgency that all CSIR labs, I'm still an ACSIR professor, why can't my thoughts, my results be taken up by CSIR labs and proved either way? Yes, it's good or it is bad. These are structures of doxorubicin, that is cisplatin, carboplatin, that is taxotere, and I've had to deal with some of these drugs also from the point of view of patent laws, and there's considerable interest and litigation on these matters in the Indian courts, in the American courts. This is a report from Cancer Nano Journal 2011. Water soluble C60 for anti-cancer treatment or cancer treatment. Some of these papers are coming from Russia more than other countries. The reference is there. Please read the paper. I am not discussing the paper. I am only mentioning the result. What is the advantage of water soluble things? You can dissolve water and intravenously inject. More important, you need not take the drug which circulates from head to foot. You can inject it locally, target the cancer or the tumor. Side effects could be less. And the dosages are much less because it's nanomaterial. It is slow release in some cases. And I will mention there are other ways in which we can use it. Possibly we could even do, as I mentioned, Amrita Hospital doing photodynamic therapy for treating cancers and tumors. Now one more advantage. Fullerene derivatives of this type are especially useful to modulate the cardiotoxicity of the anti-cancer drug doxorubicin. Here is a rat where cancer, lung carcinoma has been induced. And the first one on top is the control, as you will see it. The first one on top is control. The second one is protective effects, mitosis and apoptosis. The third one, when the dosage is 5 milligram per kilogram body weight, in the protective effect, there is 35% tumor growth inhibition. The lifespan of the mice increases by about 30%. The inhibitory effect, in the inhibitory effect, as I mentioned, you can do the treatment after surgery or you can do the treatment before surgery. Adjuvant chemotherapy or neoadjuvant chemotherapy. When it is the inhibitory effect, maximum therapeutic effect is about 25% growth inhibition of tumor, and the lifespan of the mice increases by about 22%. These are promising candidates for clinical oncology, clinical cancer treatment. Many families are suffering. Every other family that I meet is suffering. Somebody or the other in the family has died because of cancer of one kind or the other. The other day I lectured in B.G. Vaishnav College. The young man who conducted the program came to me after the talk and said, "Sir," he's 20 years old, said, 12 years ago my father died of brain tumor. Sir, if you are saying that these things are available, should not these things be hastened so that they become available to the common public, remember, at the lowest cost, if not free? The poster boy of such adapts is a tris adapt. 1, 2, 3. This is some kind of malonic acid derivatives, and they are considered some of the best materials that have been produced thus far. This poster boy fullerene antioxidant is pushing the field closer to the market. When you introduce this, Parkinson's disease seems to get reduced. These are antiviral, antiretroviral, that means useful for treating HIV AIDS. The Ukrainian Ministry of Health has recommended drinking water where 0.0002 milligrams per 100 ml this C60 is added, so that the population will not suffer from most of the diseases. Somebody has even mentioned in the internet, you can see it, that these have been converted into nasal sprays, and one nasal spray just with this water soluble derivative in large amount of water is taking care of Alzheimer's disease. Here is a report published, I believe, very recently, where we are told that these water-soluble fullerenes are extremely useful in treating arthritis. Younger people in the audience may not be particularly aware of what arthritis means and how painful it can be. But older people in your homes, many people suffer from arthritis and they have to take painkillers every day. If taking a sip of such water containing water-soluble fullerenes, being water-soluble, the chances that they will be washed out from the system are much higher. I think it is a very promising possibility. As I want to come to the last part of this talk, I want to advertise just one word here. This material, which you can search in the internet, is known as Fullerenes, F-U-L-L-E-V-I-R, Fullerenes. And these are candidates for theranostics. I had mentioned in the beginning of my talk that I shall refer to theranostics. What is theranostics? Diagnostics and therapy together. How nice. if such a gadget that I am mentioning now, photoacoustic imaging, is produced in secrete, what does it involve? A nanocarbon material. The nanocarbon material is in fact injected directly into a tumor with a micro syringe. Wavelength, you impinge this on the tumor cell, light is produced from the tumor cell. Then you use another laser of another wavelength. There is apoptosis. The cell, the cancer or tumor cell, actually breaks. By breaking, it makes sound. You can expand, you can enlarge that sound, listen to it. This leads us to what is referred to as photoacoustic imaging using water-soluble functionalized C60 as an in vivo biosensor material. This is a very, very hopeful kind of a thought published by Chen et al. In 2012. The reference is given. The word theranostics there refers to the name of the journal. And the entire details of this particular photoacoustics imaging can be accessed by you by reading this paper. I think it's appropriate that I close this lecture with a photograph of Professor W. Croto, who actually discovered Buckminster fullerene and was given the Nobel Prize. Subsequently, he discovered this in 1985. And in fact, his advice to youngsters is, don't run after awards and prizes. If you do so, you will suffer a lot in life. Don't do so. Work for work's sake. In India, this philosophy is not new. It is very well known to us that our job is not to run after the fruits of our work, but it is our duty, and our duty is just to do our work honestly. This may look a little anachronistic and old-fashioned in the modern day world where young people want prosperity, happiness, good lot of money very quickly. Nobody is against it. But don't headlong go into something like this so that it becomes a disaster for you, is what my advice, says W. Croto. My advice is to do something which interests you or which you enjoy. Though I am not sure about the definition of enjoyment. And do it to the absolute best of your ability. Croto died in 2016, but has left us very much richer. Fullerene-like structures have been found recently in Chinese hibiscus flower. There are even reports that such substances are found in the circumstellar space around the fading star or Coronia Borealis. A paper published in 2011. Deep down in outer space and in starburst of planetary nebulae. There is a hypothesis, there is a theory that life on Earth, all of us, have originated from asteroids which have come and hit Earth and brought along with it life, which has led to the kind of life that we are aware of. Are we to be surprised, therefore, that such water-soluble fullerenes are so useful in curing so many diseases, so much of benefit to human beings in the materials science and the material world in terms of making efficient solar cells, for that matter, as MRI contrasting agents, for lithography, nanolithography, nano devices. But I think not only the material aspects of our life, but also the fact that they could bring such benefit to patients, some suffering from innumerable diseases, which I need not repeat. These are all papers which I have read in the last 1 year. Many of them have been published in the last few years. The world, therefore, is waiting for these benefits to come to our populations across the globe in an accessible, affordable manner, so that suffering of human beings gets considerably reduced. We are not talking about a magic cure, but if there is a ray of hope, why not pursue? Thank you for your patience.
So how does it cross the blood-brain barrier? Because that is the...
I think one of the points could be it's very small nano size. And I know very few materials cross, very few drugs can cross the blood-brain barrier. How do we treat Parkinson's currently? What's the drug of choice? Would possibly answer your question. I think the drug of choice largely comes from the fact that we talk about dihydro.
Make the progress of this process. How this C60 can influence? It has been proven, but what is the
Sir, కొంచెం